Each episode, we're going to dive into evidence-based strategies, cutting-edge research, and real-world insights to help you elevate your practice and empower your clients. Okay, so welcome to the Rehab Blueprint podcast. Okay, welcome to the podcast. Today, we are going to be talking about something very interesting. So the title of the podcast is Fit for Practice, the Healthcare Practitioner Paradox. So welcome to the podcast, Luke. How you doing?
Good, man. Good to be back after a few weeks of absence.
Yeah, good to have you. Good to have you. And Giles, how you doing, mate?
I'm good, man. Yeah, always happy to be here.
Always a privilege to have you. So today we're going to be tackling what some would maybe perceive as a touchy topic. Should healthcare practitioners embody the healthy lifestyle they promote? So in this episode, we're going to explore what many perceive to be a paradox of the clinicians who advise on movement, nutrition, and recovery, yet they struggle to apply it in their own lives. Does it matter? Does fitness impact credibility, patient trust, or professional burnout? So join us as we're going to challenge these assumptions, share our own training journeys, and unpack what is fit for practice. What does that really mean? From the outset, any thoughts to get us started before we crank into some of what the research might show from either of you guys?
I think it's important to clarify it's not about body shaming, right? Let's just clarify this is not about aesthetics, all right? Having a ripped six-pack like Brogan doesn't equate to good health.
I'm the one person on this podcast that doesn't have a ripped six-pack. Okay.
And it can be taken out of context. So I think it's very important just to put it out there before you send a barrage of aggressive and angry tweets and posts to my profile. It's not about body shaming, and it's a larger topic. And it's only 30 minutes we're talking about, and there's lots of different nuances that can be taken away from it.
Exactly. Luke, any opening thoughts?
No, Giles ticked it off, but again, I think it's one of those topics. Sure, like we're going to have a bit of research on it. It's going to be a bit grey in some areas, but I think all of us being in clinics, are going to come down to our experience with patients as well too, which I know I've had a few experiences with patients going over some of this stuff. I'm sure Giles have. I'm sure you have as well. So we'll cover that.
Good thoughts for sure. And that was a good disclaimer. I mean, we're talking about general health. We're going to be talking about performance, not necessarily like what Giles touched on. This is not meant to offend. However, if you do find yourself challenged by the things we're saying, maybe that's a good indicator. I know for myself, I do my absolute best to get into the gym, train hard. We're actually going to talk about what we do, because I think it's important for us to state that we're not just sit here pointing the finger. We all actually have our own journey when it comes to health and fitness, and we're all constantly getting after it. However, when it comes to me and Luke, obviously the ethos and kind of a lot of the meaning behind what we do at the Rehab Professionals is along the lines of, hey, we're not just here to talk the talk, but walk the walk. And what that means is we promote longevity, health, span, well-being, and performance, and everything that we do and how that integrates into rehab. So I think it's a massive mistake to be promoting one-dimensional or mono-interventional interventions like manipulation or soft tissue work, dried needling. I think it's a mistake to only provide that without integrating total health into it or overall health and performance into it. And that's why at the Rehab Professionals, we're so big on, as clinicians or therapists, actually being in the gym and doing it. And a lot of that comes from some of the influence that obviously we had from Dr. Locke and Dr. David Johnson, where they would often talk about, do you have calluses on your fingertips from typing on a keyboard on Instagram all day? Or do you have calluses like on your hands from lifting barbells? And it's funny because I remember David talking to me saying that when he looks to hire healthcare professionals, of course you have to have all the legitimate things on paper, but he said that before he even looks at a CV, he's going to look to see if they've got calluses on their hands. And of course I think that's more metaphorical than literal, to be taken literal, but I think you kind of understand what he's saying. And I said this on the last podcast too, when we were talking about Rob and the fact that he was like giving away his bodybuilding trophies and he kind of downplays his bodybuilding career. And I'm like, don't downplay that, because there's so much kinesthetic awareness, biomechanical opportunities to learn through doing that people downplay like that. And so we can learn academically, we can do the work, the science, the academia, we can read the papers, we can even learn the clinical stuff. But if we're not looking after ourselves, if we're not backing up what we're saying, I think it's quite problematic. Me and Luke obviously have that opinion because it runs through our business. That's like part of our total kind of business ethos. But then, Giles might have some different perspectives, which will be interesting as well. So, Giles, tell us, what do you think about it? Do you think this is what I want to ask you? Do you think healthcare professionals, clinicians, or therapists, allied healthcare, do you think they need to be A, healthy, and B, do you think that they need to be regularly participating in exercise and resistance training, etc.?
It's a really difficult question to answer. There's the ideal answer, the sort of utopian answer of absolutely the therapist should be engaging in great nutrition and exercise and should practice what they preach and should be this sort of pinnacle of physical, of health and well-being. But that's not the reality of life. Busy clinic days, busy clinic shifts, lots of patients, and it can be very challenging to maintain your own health and fitness whilst you're in a very, very busy environment. So it can be very challenging for manual therapists in that respect. And also, a lot of manual therapists don't really understand exercise rehab or training or nutrition because as an osteopath, we did a 5-year degree and we didn't cover any real exercise, any real nutrition, any real rehab at all. So we did 5 years, very, very manual therapy based, coming out into the real world. And the reality of rehab is that what the patient's doing off the table is far more important than what we do on it. And the collaboration between manual therapy and physical exercise creates great treatment outcomes. But if the therapists are not being trained or educated in exercise, rehab, nutrition, not just for themselves, but for their patients, then they're missing out on a massive plethora of positive outcomes. So, look, ideally, I do believe that therapists should have a basic understanding of how to eat well. They should have a basic understanding of how to manage stress. They should have an understanding of how to manage anxiety. They should have a fundamental understanding of exercise and basic rehabilitation. I'm not talking 6-pack in 6 minutes. I'm not talking about, Olympic level lifting. I'm not talking about any of that. Basic standard stuff should be paramount because we practice what we preach. I'm not going to give my patients exercises if I don't know how to do them myself or if I don't believe in them myself. So it's a really interesting paradigm. And also from experience as well, there's massive trust elements there. The patient comes to you looking for these therapists to be, pinnacles of health and well-being and to give advice. And if the therapist is sat there smoking, eating a Big Mac, clearly struggling to do their job, there's a lack of trust there. I always find it quite challenging and interesting when I teach students and they literally have no understanding of basic exercise and nutrition. I do think it's massively missing and something that a lot of therapists have to go outside and learn externally. And I do think that is a massive problem in manual therapy education. So it's not about the therapist being this Adonis, but fundamental understanding, I think, is absolutely crucial. Because how can you really give advice on people, if you don't understand it yourself?
I do like how when you said Adonis, you went like, Adonis, like you are that? Like,
well, we are a rarity.
You're like offering up yourself as the perfect therapist, the perfect.
It always reminds me. I've had treatment before, and as we all have. And one of my colleagues is an osteopath who smokes. Now I don't smoke, and people are free to smoke. It's up to them. I don't mind. It's no problems. But when you're being treated by someone who smokes, and that smell, sort of that pungent smell on their breath, in their clothes, and they're talking to you about living a healthy lifestyle and walking and all this sort of stuff, and it's just, I just have no faith or no trust in that. It's a bit like when I went to my GP for a Wellman check when I was 40, and the nurse was giving, a lovely lady, but she was giving me advice on nutrition, and halfway through started asking me my advice on nutrition because she was sort of morbidly obese, and it was quite ironic, really. I find there's a trust element there, and as superficial as it is, and I shouldn't take that to heart, I do think sometimes the first bite is with the eye.
Yeah, it's a really slippery slope in terms of like, what we say in terms of like people's shape, obviously, because people are going to be offended no matter what you say. Um, on that topic, have you like, for example, you've got people like Adele who lost weight and then her own fans turned against her, because she lost weight. And even recently, Lizzo, I think it's Lizzo, yeah, she's like lost weight, and then her like I just saw an article before I came on this podcast. It's people were like upset saying she's a hypocrite because her whole I suppose model was based around her being a large over healthy. What's it called? It's like health at every size movement. Anyway,
Yeah,
so
but that I don't think that's really that true because ultimately metabolic disease, diabetes, cardiovascular issues doesn't really care what you think. That's a metabolic issue. You can be as positive as you like. Diabetes doesn't care.
of course there's clinical realities, right? There's clinical realities
and
to this
this is
stuff.
it. And I think so. Anyone can be what they want to be. They want to be. It doesn't matter, but they have to understand there are health implications that do go with it.
Hmm.
As a therapist, if I have a patient come to me, I am very honest with my patients. I'm not here to offend people. I'm not here to say anything that's offensive, but you may be offended if I'm honest and say, listen, some of the reason why you may have back pain, knee pain, ankle pain is because you're carrying excessive weight. And as part of the treatment process, we have to look at diet and nutrition and think about these steps and actually be honest with our patients. There's no point in sugarcoating it.
Yeah.
If you can pick these metabolic diseases up, if you can change people's lifestyles, I mean, crikey, if someone comes to me, what am I going to be concerned about? Cracking their neck or treating their nutritional issues, getting them to lose weight and maybe extend their life or reduce their risk of cardiovascular issues, reduce their risk of diabetes or other metabolic diseases. That's far more important than doing a Gucci manipulation. And I think we have to be a bit honest and realistic sometimes with our patients.
We've talked about this on the podcast before because you take it to the next level and you could say, okay, someone comes to you because they want to be adjusted, and then you smell smoke on them, and then you're now faced with the reality of a decision as a clinician or as a allied healthcare professional or whatever your role is, whether you're going to go down this route where you could have maybe some short-term modulation of pain or some manual intervention, or you're going to exercise. Exercise probably the poor word, but implement some education around a health discussion, especially on smoking, because the best thing you could do for that person would be to help them quit smoking for their health, right?
And it's not about being dogmatic. It's not about being righteous. It's about having an open and honest discussion with your patients, understanding that they have freedom of choice and freedom of will. And as the GP says to you, as I say to my patients, if you want to smoke, smoke, but there is a higher risk of cancer. Please be aware of that. If you want more information, go there. If you're interested in stopping, I can give you some information. If you don't care, carry on.
What we're getting at is that there are clinical realities. Obviously, there are physiological, medical boundaries. What I really want to kind of bring it back to is like, okay, are you fit for practice in terms of like, do you have the stamina to do what's required of you? It's like for some people that are in the industry, they're doing long hours. Chiropractors and osteos, maybe they're just doing kind of like the classic 9 to 5. If you're a sports osteo or a chiro or a physio and you're working with sports teams, then obviously the requirements are going to change. At a base level, there's going to be a level of fitness that is required to do the job. What I'm saying is, are we required to go above and beyond that? Are we required to be in the gym, hands on barbells, actually doing this? I know when we talk to Jordan, for example, he's like, anything's better than where you are now. So just go for a walk. And when we asked him about what he does, he's got a kid, he's busy, he's running a business, he's the boss of his company. He's got staff members, he's got a partner, he's got a wife and kid. And he was saying that he wants to do more resistance training, but he doesn't actually get to do much. And one thing that's a staple for him is his walks. Pretty healthy guy. Like he's a slim guy, but he's healthy. So that leads me to that really interesting question. Okay, we've got the base level fitness, which I think everybody should have. But what about going above and beyond? What about competing? What about having athletic endeavors or goals of your own? Do you want to give us your perspective on that, Luke, considering you're a competitive weightlifter yourself? You've played rugby, you've played sports your whole life. And that's something that's obviously very close to your heart, and that got you into health because you loved it so much.
Yeah, I think that's the interesting point to touch on is, my life of chiropractic and the sort of rehab stuff's only really been the last 3, 4, maybe 5 years, whereas I grew up playing rugby when I was 5. So I feel like that was sort of my prior life to all of that. Like I've been playing sport since I was a child. So getting to where I was, university, it was just second nature for me. I probably stopped playing rugby when I was about 20, but I was still weight training on the side. I was like every other 16-year-old kid who got into that around that age, just wanting to get big and jacked, and having to carry on training with that sort of method on the side as well as footy. And then sort of transitioned into, more weightlifting, running, CrossFit sort of stuff during my years of study. I personally think, as health professionals, we should be doing some sort of baseline exercise. But when Giles mentioned before, he touched on a good point I hadn't really thought of before, is not everyone is led into doing so prior to, their career, maybe as a manual therapist. They don't really have a background of doing sort of that stuff. And then work gets very busy. They're seeing a massive patient load. So they never really put in the thought of picking up anything like that. And we saw it firsthand, Brogan, right back at chiropractic school. I mean, the one thing they sort of did try to do was implement what they call ChiroFit. So it was during our studies where they went through a phase of like, you have to have some level of fitness and baseline of strength to be able to withstand a full shift or day in clinic. So they had us doing air squats, front planks, push-ups, everything like that, which I think, looking back on, it's at least they had the right frame of mind to actually implement something like that. But for me, I do have a bias to thinking we should all be doing something. We don't have to be weightlifters. We don't have to be powerlifters. We don't have to be marathon runners. But like you touched on with Jordan before, he'll still get 30 or 40 minutes of walking in between his shifts, in between patients, if he knows he's got a fully booked out day.
Here's the thing, right? If you're a medical doctor, if you're a surgeon, if you're a pediatrician, if you specialize in something, if you're an osteo, allied healthcare, like whatever you're doing, it does depend on what you do, in my opinion. And I'm going to explain why I believe that. If you're doing general care, I think having a general base fitness is probably good. So like walking or running, eating well, having a basic understanding of those things so that you can give out of what would be like, a healthy place. And there's that classic analogy of, right, like you can't give out of an empty cup. So making sure that, and it goes into these multi-dimensions of health, right? So it's not just going to be physical, but like emotional, mental, and psychological, and all these aspects of health. So I think that's important. I think it's pretty broad to say that, and I think that's important. That's also going to be like on a spectrum because it's going to be based on people's opinion as well. Even though there are clinical realities we discussed, it's going to be based on opinion. What is fit? What is healthy? For us, we specialize. What do we specialize in? Well, rehab. And so if you're going to be specializing in something where the fundamentals are movement quality, load, various load, isotonic, eccentric, isometrics, strength science, sports science, that is all very much intertwined into what we do. That's what we do, right? We understand the parameters of motion and movement and load and biomechanics and physics and kinematics. Like that is what we do. So if that is your wheelhouse, then I think you should participate in some type of resistance training, weight training, sports-based training. That's my opinion. Now, I don't think if you're a general practitioner, I don't think you necessarily need to do that. Like we're sitting here, this is a very interesting conversation because Giles is what would be considered a general osteopath, and you would see generalized patients in your practice. You're also an educator, so there's no real onus on you to do anything more than just be a base level healthy, in my opinion. As there's more onus on myself and Luke because we're promoting ourselves as rehab professionals. I am a world champion powerlifter. Luke is a competitive weightlifter.
Just a weightlifter, man.
So yeah, no.
Hold on, what am I?
Yeah.
I won best knobbly knees at Butlins 2 years running. So
Okay.
pretty big deal. Don't like talking about it.
Yeah. Do you want me to put you on blast, telling everybody your past, all the amazing things you've done?
Actually, you make a valid point. In the police, you have to do an annual fitness test, right? An annual fitness
PCT.
test to do the job. Yeah, to do the job. And then the more specialized you get, the harder the job is. For example, firearms officer, the fitness test goes up a notch. Now, in osteopathy, we get asked every year, are we mentally okay to do the job? Do we have any criminal convictions? That's all they ask us. They don't ask us if we're physically able to do the job. And now, myself and my colleagues published a peer-reviewed paper about 10 years ago on hand and thumb injury in manual therapy. we were writing it to look at ways that we could reduce stress on the therapists by using things like instrument assisted work or activators, speeder boards, other things. And actually, workplace injury, when we took the research from Australia, is massive in our profession. If you're a manual therapist, you're going to get injured, right? You're predominantly probably going to get wrist, elbow, shoulder, neck, thoracic, or lumbars are the most prominent. Some of the risk factors are basically doing manual therapy, doing your job, too many patients, not enough rest time, too stressed, too anxious, moving people around. All of these contribute to putting you at risk. Now, for me, one of the reasons why I train is so that I can perform my job as best as I can with as minimal stress on my body, so that at the end of my shift, I'm not exhausted. And that's why I do believe it's important, if you are physically treating patients, unless you're an acupuncturist and you can just stick it in and then get back on Tinder, or
a GP.
Yeah, or a GP. If you're actually physically moving the person about, doing some form of technique, I do believe it's important to have a good baseline of fitness. Not only to be able to do the job, but to protect yourself. Because ultimately, if you injure yourself, that patient is not going to pay your bills. He's going to go, thanks very much, see you later. And if you have injured yourself in clinical practice because of something, trust me, it's a big financial issue if you're not able to do the job. And I've got to be honest, I've spoken to therapists and students who have said to me, they've been out 6 months. I don't think I can physically do this. I can't do this job, right? I hear it all the time. It's too much. It's too physical. And I'm like, you've spent £80,000 and you've only now realised you've got to raise your game a little bit. It can be very, very challenging on that front sometimes.
Yeah, and so that's a really good point, Giles, because what you're saying is in your profession and in the chiropractic profession, or whether even if you're a physio and you're doing a lot of manual therapy, that baseline fitness that we were just discussing, that may be less for someone else, has now gone up, right? Because you're going to have to be fit and able, and you also want to be able to maintain the stamina and not get injured day to day, week to week.
Now, I'm not talking about those weird osteopaths that are jumping up and down on bozo balls, pretending to crack necks. Have you seen those absolute numpties? They're in the osteos or chiros in the gym going,
with bands,
they're dry humping a bozo ball. Do you know what I mean? They're just
functional training.
That's it. Yeah. That just, oh God, I've got to be honest, I cry.
It's like a ritual. It's like this big ritual.
Do they honestly take themselves seriously when they do that? I mean, is it a real thing?
It's very legitimate. In fact, once upon a time, me and Luke kind of did that, when we were buying into when we bought into the specificity model.
A couple of nerds.
We're numpties, man. We're total numpties. In fact, we bought.
But it was more, man. It was more the speeder boards. I had 15 of those lined up like a food chain, man, and you'd just be lining them up.
Dude,
I've still got my speeder board.
It's where they're dry humping those big inflatable balls and things and jumping on them and stuff. Like they're getting
body
match
drops.
ready for war. You're basically trying to smash the person.
Your body's slamming. Yeah.
So let's be really specific on the joint and then body smash them.
Yeah. So obviously, if you're a chiropractor and you're an activator practitioner, then like your baseline for what is required is going to be lower, for example. So I think we can establish.
I know a guy actually tore chiropractor who tore his pec from side posturing.
Yeah, people do hurt themselves from side posture.
Yeah.
Listen, I had a student turn up on one of my courses, and she had her whole hand in a cast. And she basically was doing a massage on a patient. The thumb got caught in the armpit because he was lying prone, got caught, and she slipped, and she literally ripped the whole of her tendons. It was just mashed.
Damn, how much cream are you using?
Oh, dude, she was
slippery salmon, man.
But luckily, she was living at home with her parents, right? So I said to her, "How are you making any money?" She's like, "Well, I'm off work now for 4 months." And she's like, I'm at home with my parents. And I'm like, that's really lucky. So I injured my lower back. I've got 3 prolapses. And occasionally, that's why you'll never see me lift people. I'm not going to lift someone to crack their CT when I can do it prone or whatever. It's easier ways for me to do it. I did a lift on a patient in clinic, and as I lifted them, their CT went boom, and my lower back just hyperstimulated, and the whole of my lumbar spine just locked out. He went, "Cheers, mate," walked out. I literally thought that I thought I was in trouble. I sort of had to cancel 4 patients, couldn't move, and I charged a lot of money. So that cost me, the cancellation of those 4 patients cost me a shitload of money. The following week, I had to get a guy to come in to do all of my soft tissue work for me. And I literally stood in the corner of the room, and then I'd waddle over, do the adjustment, come back, and then brace myself. But I'm self-employed, which means I have a self-employed immunity. I have to work, because if I don't work, I don't earn. If I don't earn, I don't eat. And therefore, I've gone to work when I shouldn't have. I've had surgery. I've been in work the next day. I had pins in my foot in an air boot. I was in work the next day. And that's, as a self-employed people, we have to do it, which is why looking after ourselves physically and mentally to do the job is a lifesaver. And if you're not looking after yourself, well, how can you look after your patients?
Very true. Okay, so let's look at a little bit of research, because obviously the research on this is going to be varied. I think there was like a baseline belief, or something that we could all agree on. It's like, okay, yes, exercise is going to make you healthy. Living a healthy life means you're going to likely do a better job, in whatever job you're doing. So I think like that's pretty much common sense. So first things first, there's some research showing that those that exercise or are healthy and implement those types of interventions in their own life are more likely to educate patients on it. Again, I think that's fairly common sense. If you're going to be doing these things in your own life, nutrition, training, you're going to be more likely to talk about it. So there's some really great resources from Frank ETL. Really, healthcare professionals who practice healthy behaviors themselves are more likely to counsel patients on similar behaviors. Another research study showed that physicians trying to improve their own health habits are more likely to counsel patients on those behaviors, again, to support that. And there's another one that shows personal health habits are strongly correlated with counseling rates on various health promotion topics, e.g. physical activity, diet, smoking. Another one looks at provider-centered health promotion interventions improve both physicians' personal health habits and their counseling practices. Another one shows those who are encouraged to adopt healthier personal practices increase their rates of health promotion. So I think that's fairly obvious, but it's good to have some research indicating that and kind of just showing it. When we look at how the practitioner's health would impact the patient, there's some research on that too. It's often very subjective based on how we're getting the data, because obviously you kind of just have to, it's just like questionnaire based, a lot of it, because you just have to kind of ask people questions on what they perceive and what they think. But how your practitioner presents is going to be interpreted in various ways. When you walk into the doctor's office, you make 14 minor assumptions on someone within the first second or something like that, so of course, like, we're constantly thinking, and you don't want to say the word judging, but it's like an evolutionary mechanism for us to be to judge people based on how they look. So there's some research here that shows that doctors who disclose their own healthy practices are perceived to be more credible, motivating patients to follow their health advice, which is a good one. There's also a study from 2000 that looks at when talking about one's personal health habits with patients, it will improve health promotion delivery and also increase the effectiveness of the care that they're doing, which is really interesting. And then another one showing that overweight doctors were more trusted for diet advice than normal weighted doctors. And so you're probably wondering, like, hang on, that's contradictory. Yes, it is. I left it in here for a talking point, because I'm not just here to give you one-sided answers. I'm not just here to give you resources that I believe in. I came across this pretty well done study, actually, that shows that overweight doctors were more trusted for diet advice than normal weighted doctors. But obese doctors were more likely to be perceived as judgmental. Regardless, the psychological mechanisms behind why that is, I think we can discuss.
That'd be because they've gone through the struggle themselves, so they're likely to be able to relate to the patient's issues. It's a bit like if you've had the injuries. Yeah, so I've had back pain, I've had 3 prolapses, I've had facet injections. So when a patient comes to me and says, "Oh, I have back pain," I go, "I know. I relate. I've been through the process."
Yeah, it's a little different, because like, you got back pain like it was an accident, and you obviously agree it's a bad thing, but it gets a little bit more complicated, right, when a doctor is unhealthy because they can't get it together, and then patients are saying, "Oh, we trust him more." I think it comes down to the fact that, yeah, they feel less judged. To be honest with you, like, I remember I sent Giles a photo of Ollie Murs' transformation. It was in the newspaper, and it was Ollie Murs before and after, and he looked great before, but his after was phenomenal. The dude got down, he worked hard, man. He worked his ass off, got down to single percent body fat digits, I'd say, and he looks really good. But the narrative of it wasn't good on him. The narrative was like, haha, sucker, all women prefer the before photo, not the after photo. And I was saying to Giles, I was like, I wonder if that's accurate or if there's like an element of jealousy or an element of intimidation, when someone else kind of succeeds. I know in New Zealand we've got tall poppy syndrome, which is like quite prevalent. And it's even with this one, like I wonder the psychology behind it, whether these people, they are more likely to trust that doctor because they're bigger, like you said, because they feel like they can relate. But like relating to someone's poor habits is not a healthy thing anyway.
No, no.
So it really does kind of beg that question. And I do find myself wondering, this study is a bit of an outlier because I just went through the fact that there are other studies that directly contradict it, right? Saying when doctors are healthy, they do come across as more credible. So it is kind of one sticking out of the pack, but it is one worth discussing.
When you look, for example, at like placebo-induced analgesia, you look at pain reduction through placebo, patients' expectations of their therapist. So as a patient, if I come and see you and you're well dressed and you look medical, I will have a reduction in pain because of my perception of you. If you charge me a lot of money, I will also reduce my pain levels because I've then financially invested in that treatment. So, we do have these preconceived ideas and when we're looking at our therapists. So I guess from a placebo-induced analgesia perspective, it affects our pain levels. And then maybe from a trust perspective as well. It's weird how the psychology of the patient, and that's why as we always discuss, we're not trained in psychology, and we should be, because half of the treatment we do is physiological, half of it is psychological, and it just shows you how interesting the brain is.
Yeah, and look, trust is so important. It's very, very important. So when it comes to trusting your doctor, your therapist, your practitioner, it is like a significant thing. So there was some research obviously that looked at that as well. So patients with complete trust in their doctors had 2.27 times higher odds of attempting weight loss, and also had trends for increased exercise and other things like salt reduction, for example. Again, even that in itself is contradictory in some ways because it's saying like, hey, patients that have more trust in their doctors are going to be more likely to actually participate in weight loss. So it's interesting. And then there's quite a bit of information on burnout and overall wellness. So I didn't go too deep on this because there was actually quite a bit. But nonetheless, I'll include some in the show notes. Some research here showing doctor burnout and well-being are linked to increased reported medical errors. Poorer well-being is related to higher error rates, emphasizing the importance of healthcare provider mental health. Doctor well-being, another study, doctor well-being is positively associated with clinical performance, with burnout having a negative impact on patient care quality and safety. I think this is common sense. Another one showing that doctor well-being is crucial to patient care, as better well-being is linked to higher quality patient care. Poor well-being is associated with lower care quality. So there's various research here. I'll include it all in the show notes. Go through, read it yourself, critically appraise it. Don't just take our word for it. But I think we're being pretty fair here anyway. I think we're critically thinking and being pretty open to both sides here and trying to present information from both camps. So yeah, some interesting information there. I do think it would be helpful for us to discuss what we do. We all come from different parts of the world, and we all have different upbringings, come from different parts of life. We all do things slightly different. And I do, like I said, it is interesting discussing things with you, Giles, as you're like what would be like a general osteopath, you're an educator, you're a business owner, you're a husband, you're a father, you're ex-law enforcement. So it'd be very interesting to hear what you currently do. I know what you do, but it'd be interesting to hear what you currently do. And then obviously also it'd be cool to hear what you do, Luke, and then I'll finish it up. So you start us off, Giles. So what do you do to stay fit and healthy, mate?
Oh man. So for me, exercise it's endemic in who I am. It's something I've done and done since I since I was about 16, and I wanted to get massive. That's for me, there's a duality there. For me, exercise de-stresses me. It's a way of reducing my own anxiety and stress. I turn my phone off in the gym. I train for a good hour and a bit. I'm not having any hassle, any stress from the outside world, and I use that as my time to decompress. And then there's the physical benefits. I'm going to be 47 this year, and so for me, exercise is not about looking massive. It's now about maintaining muscle strength, hypertrophy to a degree. It's about leveling up my testosterone. It's about training in my 40s to move well in my 80s. So that's how I look at training. So for me, yeah, I've got 2 kids. I run multiple businesses. I travel all over. I write, I publish, I research. But for me, I still train. So as someone who's 46 years old, I train 3 days a week, Monday, Wednesday, Friday, 3 full body training sessions. One day is a priority push, one day is a priority leg, and one day is a priority pull. So it's full body training 3 days a week. On the Tuesday, I do a 5K neat walk. So nice and easy 5K, but I wear a 16 kg vest. On a Thursday, I do an hour and a half of calisthenics and gymnastics, predominantly for mobility work. That has been a game changer for me. Thoracic mobility is now something that I give all of my patients because it's such an important part of the rehab process. So for me, hips, thoracic movements, thoracic extension work, fantastic. And then on a Saturday, I do another 5K walk. So I try and do 3 strength days a week, and then 2 to 3 sort of mobility and cardio days a week. And then my calories, I track my calories, I track my nutrition, I track my hydration. I get a good 8 hours sleep every night. I love a routine. I go to bed every night at the same time. I eat the same stuff in the morning. I'm very, very regimented. I love a bit of prior preparation, prevents a piss poor performance. So it's all about the P's, mate.
That's the police in you.
I can't help it, man. When I joined the job back in the day, like in the late 90s, I was slim. I was so skinny. And one of the reasons why I got into training was my skipper at the time turned around to me and went, mate, they're going to break you. You're not going to last 6 weeks in this job. You need to hit the gym. And that's how I was forced to do it, because honestly, I just wouldn't have been able to do the job. That's how I got into training, and it's never left me. It's just part of my life now.
Wow, that's good. Luke, what about you?
Currently at the moment, I'm sort of in a mix between, I think I mentioned it on a few pods ago, weightlifting and running at the moment. So Olympic weightlifting for me will consist of about 3 to 4 days a week of purely just barbell work. So, hitting the snatches, clean and jerks, squats, all that sort of strength stuff, with a little bit of accessory work in there just for more injury prevention. I think Olympic weightlifting for me has definitely been an interesting experience with sort of what joints you're loading mostly throughout a lot of the movement. So it's always going to be hips, knees, shoulders. So I found when I did start to slack off and drop off on a lot of the accessory movements, so that might be your Bulgarian split squats, your RDLs, your core work, everything like that, little niggles and injuries did start to creep up. So that's been an important part of my training to keep in. But I'm also running about 1 to 2 times a week at the moment too, just for a half marathon coming up in about 3 weeks. So that's purely just for a bit of fun. I'm not trying to PB times, anything like that. There's a group of us going up to do the half marathon, some of them the full marathon too. I've always enjoyed running, probably because I've grown up playing rugby. That's a massive part of the sport. And also it's just mentally too, it gets you outside of the gym. A lot of the time it can get, super dark and gloomy, staring at a barbell, chalk on your hand a lot of the time. So it does get you outside. So that's sort of the training that's going for me at the moment. I will look to cut off the running after that event and focus more on weightlifting, because I've got a couple of competitions coming up, one in June, and then hopefully look to push nationals in August, which will be good. That'll be my first bigger comp on stage. But back on the whole burnout thing, like I've definitely it's definitely been a fine line with balancing that for me and having that much training load. It's probably why I moved away from more CrossFit style training, was because sessions can become 2 to 3 hours. There's a lot of high intensity cardio based stuff. So I found when I was doing that style of training, getting into clinic and trying to see patients was just a big no-no. It didn't stack up nicely for me. So I'm definitely still trying to learn on how to balance and enjoy training and push the limits of for my body, but also be able to turn up to work and get through patients. It's the biggest thing.
What about nutrition?
Nutrition wise, so I about 6 months ago I did start working with a dietitian, which was my first experience with a dietitian. Prior to that, I just used to sort of eat intuitively, which I sort of do now, but I needed to get my macros and total calories on track. I just wasn't eating enough, and I was getting to that stage of being very burnt out, particularly training through that CrossFit style. Um, so yeah, to give you a bit of an idea, I was probably eating around maybe 3,500 calories, 3, 4 on a daily basis. When I started working with him, I got bumped up to 4,000. So that was about a 500 calorie jump. Obviously, proteins, fats, carbs, everything went up. Particularly carbs. I wasn't eating enough carbs to be able to fuel those weight sessions. And yeah, it's been an interesting experience in terms of like body composition as well. I've definitely put on weight, but it's been a lot of lean muscle mass, and I'm eating 4,000 calories now, and my weight isn't changing. So it just goes to show that at the moment for me, that's pretty much a maintenance. Um, so yeah, that's definitely been an important side to my training as well.
Supplements?
Supplements at the moment, whey protein again. I'm mixed on this. It's not a necessity, but it just helps me get, an extra 20, 30 grams in. When you're eating 4,000 calories on a daily basis, it gets tiring, man. I don't want to be eating chicken breast every single meal. So it's easy to just shake up one of those, get it back. Creatine monohydrate, that's always been a staple for me. Particularly, there's a lot of, obviously, it's one of the most well-researched supplements out there when it comes to physical benefits, but also cognitively now. There's a lot of stuff coming out on that, which is great. What else have we got? A couple of other supplements as well that the dietitian did recommend, which was beta alanine. So, the stuff in pre-workout that gives you the jitters, and then citrulline malate as well. So, both important for more endurance throughout weightlifting and running, but also a good natural vasodilator as well. So,
Wow, man, yeah, you got it down. Doing good work.
trying to. I think I'm just, again, going through a different stage. I'm still only 24. So for me, it is about moving well and longevity, but I'm also enjoying the younger years of being able to compete. Whereas, for someone like yourself, you've been there, you've done that. So it's transitioning into a new chapter and a new phase of exercise, health and well-being.
Yeah, that's true. And I see, like, listening to both of your stories, I feel like I can relate in different ways. I suppose I'm the one in the middle. So, if you're 24, I'm 34, nearly 35. Giles is 46. So it's kind of like 10, 10, 10. I don't want to say I'm over the hill because I'm not. I started powerlifting. I started training when I was 13 and I finished powerlifting when I was quite young too. So I had real specific goals. And I still remember like getting after it and like how you were talking, like having everything just completely locked in, especially when it comes time to compete. And yeah, so I did that, and my protocols when I was in the season you're in now would have been completely different. And saying that, I am a little bit old. Like I'm a little bit older now. I've got 2 kids and a family. Like Joel said, business, and everything else that's going on between research, the business, the podcast, and all this stuff. So you're trying to manage that, but for me, a lot of it's like coming down to I'm starting to think about health span, well-being. Like Giles said, he's preparing for his 80s. I'm preparing for my 40s and wanting to be in the best shape of my life in my 40s. We talked about this recently, so I'll just go kind of fast. But in terms of my training, 5 days a week. I'm running Monday, Wednesday, Friday. And yes, I'm a big strong dude to be running. So I have to be very, very, very intentional on my warm-ups and how I'm dealing with my knees. But I'm doing it. My knees are handling it. The capacity's there, and as fit and running really great as I've ever done. So that's cool. I do big walks on Tuesday and Thursday. I do the weights 5 days a week. Recently, I think it's been kind of like a push-pull split, a push-pull legs. I train legs twice a week type thing. Lately, I've been going back to my roots, bodybuilding, chest tries, back, buys, legs, shoulders, and then legs, so something like that. I switch it up. Again, I train more intuitively. I've been working a little bit more on doing higher intensity sets, but less total volume, which has been cool. My nutrition is kind of around, I'm kind of like on the lower side of calories, probably eating lower carbs, under 100 grams of carbs, over 250 grams of protein per day. The calories will fluctuate depending if I'm trying to go up, stay this weight, or go down. I'm currently going down, so I'm on a deficit. Supplementing vitamin D, some occasionally magnesium, vitamin C. I try to get my bloods done multiple times throughout the year. Just had all of my bloods done, like everything done. Everything's perfect, like came back amazingly. So I'm happy about that. Bringing it back to the importance of what we're talking about in the podcast. It's important for people to be healthy, and I don't think it's judgmental for us to say that. If you're going to specialize in something, then you should be doing that in your own life as well.
Imagine if we did have a criteria though, like similar to the police force and getting in, to the fire sort of department thing, where we had like a baseline standard for like governing all like allied health professionals, so you got nurses, GPs, EPs, osteos, where it'd be like a baseline. So it'd be like maybe say like, oh, everyone in this category, which would be more GPs probably, that their level of physical activity doesn't have to be too high for their role, but they also need to give some advice on their patients. Might be like be able to meet like a 40 to 60-minute walk, for example, maybe within like a certain time frame, or heart rate below a certain thing or whatever. And then category 2 would be, might be like your physios and things, bit more prescribing rehab. So maybe you have to deadlift this way, or and you have to sort of meet a certain tier. But
it will never happen.
It will never happen.
Yeah. And then also like education on nutrition, right? Because like you go down a rabbit hole, because if you're putting in requirements on that, then you'd put requirements on other things as well, like blood pressure, bloods, all that stuff. But anyway, we'll close because we're going on. So if people are wondering, Giles cut out, I'll summarize and then we'll close up. So we know the power of exercise and strength training for health, function, and longevity. But as health professionals, we often feel like people are doing a lot of talking on social media, and we're not seeing a lot of walking, unfortunately. So when we look at the research, clinicians who train and live well are more likely to educate patients on it. Physically active practitioners are significantly more likely to promote exercise. Patients trust and follow advice more when they see their provider walks the talk. Disclosure of healthy habits improves credibility and patient motivation. Burnout leads to more errors and lower quality care, and higher practitioner well-being equals better patient outcomes. Okay, so your personal health isn't just a bonus, it is clinical competency. And if we believe in strength and resilience, we should be leading from the front. And that begs the question to the people that are listening to this: are you fit for practice? We will close on that. Any thoughts before we close, Luke?
That's great, man. Another great episode. Good to be back on it.
Great episode. And as always, make sure you check out all of our previous episodes. This is episode 10. So we've got 9 other ones that we have that you can go through the catalog, YouTube, anywhere else, Apple, Spotify. Be sure to check out our social media, check out the clips, like, comment, ask questions. We'd like to interact and talk to the people that are listening to these podcasts. Otherwise, have a great week, and we will see you guys next week. Each episode, we're going to dive into evidence-based strategies, cutting-edge research, and real-world insights to help you elevate your practice and empower your clients. Okay, so welcome to the Rehab Blueprint podcast.